Welcome to our presentation, which is Key Considerations for Professionals Who Communicate with the Public about Dementia Risk and Prevention, an initiative led by the Dementia Carers Campaign Network. During this presentation, we will consider the importance of discussing dementia risk and prevention sensitively and appropriately. I'm Eithne Heffernan, a member of the Dementia Carers Campaign Network, which is a carer advocacy group which is supported by the Alzheimer Society of Ireland. I cared for my father who had vascular dementia. I'm also a senior research fellow in the University of Nottingham in the UK, and my research focuses on dementia and hearing loss.
I am Helena Quaid, Chair of the Dementia Carers Campaign Network, or DCCN as we call ourselves, and I am caring companion to my husband Kevin, who was diagnosed with Parkinson's disease at age 51 and young onset Lewy body dementia 2 years later, 7 years ago now.
Many people are eager to find out what actions they can take to maintain a healthy brain and to reduce their risk of developing dementia. The rationale for the DCCN choosing to discuss this topic is because the messaging around dementia risk and prevention can be confusing and even upsetting for people living with dementia, their families, and the general public, if not communicated well.
People with the lived experience of dementia, such as carers like myself, can find that we get lost in the whirlwind of our caring and supporting role, so that the need to look after our own health and well-being can be challenging and overwhelming at times.
Health advice from different experts can sometimes feel contradictory. For example, one day a cup of coffee is good for you, and the next day it's not.
It is imperative that people find reliable sources of information regarding our health and risk, because sometimes we are getting messages from research or health organisations via the media about risk factors, and these messages can be confusing. For carers in particular, it's very difficult to balance your own health in such a challenging space.
Research is continually uncovering evidence about potential risk factors for dementia, with the Lancet report from 2020 highlighting several key factors. While it is important for people to learn about risk and risk factors, it's equally important to ensure that these messages are communicated well. In my role as a researcher, my ultimate goal is to produce research that benefits and enhances the lives of people living with dementia. But the challenge is to share complex and technical findings in a way that is clear and impactful. Researchers can find it difficult to communicate in a way that meets the needs of different audiences, including the general public, patients, clinicians, journalists, and funders.
Eithne, you and your research colleagues are working in such an honourable role, which can be life-changing for so many people. I can understand the difficulty of sharing complex findings in a clear and concise manner, but careful consideration should be given to ensuring the shared information is given appropriate context and framing. It can be frustrating and indeed intimidating for people with dementia and their families to receive poorly communicated information about risk factors without context. The dementia community and the media needs to be cognizant of the fact this information can be very emotive for people living with dementia and their carers and supporters. Particularly, careful messaging is needed as people with dementia may feel they cannot change their situation. Messaging needs to be informative and factual, but please deliver it with kindness and hope.
We will now outline key considerations for researchers, clinicians, journalists, and public health officials when communicating about dementia risk to various audiences, including people with and without dementia. These are based on roundtable discussions we have held with a range of stakeholders, including researchers, clinicians, and family carers.
Key considerations are: your audience will be made up of different people, people who already have dementia, families of people who have dementia, who may have concerns about heritability, and also, of course, the general public. All individuals could be affected differently by the message. For example, people already affected by dementia can experience guilt, blame, or anger, feeling somehow at fault as if they didn't do enough to prevent it. They may have been very health conscious and aware of risk factors for themselves, but still, these people still developed dementia.
People need to be informed about dementia, but if the messaging is not careful and clear, it could create anxiety around the risk factors. For instance, some people who are affected by risk factors, such as hearing loss or depression, could become distressed. Everyone is different, and some people don't want to know about their risk, while others do.
For carers, messaging such as the importance of good sleep hygiene and physical activity can actually increase stress, because it can be difficult for carers to balance a healthy lifestyle with their caring role.
The topic of risk factors for dementia is complex, and there is much yet to be learned about this developing area of knowledge. The public may be keen to know how to prevent or delay dementia, but research findings on this topic are often complicated and still emerging, with many studies still being undertaken in this field. Care is needed in how this complexity is conveyed to the public. It is vital that this information is communicated in an accessible, accurate, and sensitive manner.
Messaging around risk factors for dementia needs to be tailored to different cultures, as they can view dementia differently. They might not all use the same terminology or have the same idea of what dementia is. Don't rely on the stereotype of a typical person living with dementia or a typical carer.
Going forward, we need a collaborative view from researchers, clinicians, carers, media and dementia organizations, and people living with dementia of how to communicate this information. It is vital to have input from people with the lived experience, and this is where PPI, or person-public involvement, is essential.
It is indeed vital that researchers and other professionals obtain science communication training and support.
It may be helpful to focus on promoting brain health rather than on risk reduction. This positive framing may be more appealing to different audiences and may avoid adding to the already considerable stigmatization of dementia.
In conclusion, research, health services, public health, and the media need to balance the messaging around addressing risk and prevention with the needs of different audiences, so that it can successfully reach and be heard by as many people as possible.
Thank you from both of us and all our DCCN colleagues for watching our presentation today.
And for more information about the DCCN, please visit alzheimer.ie or follow us on Twitter, now X, at DCCNIRL. Thank you.